Do you need help with understanding pharmacokinetics? Well, in this video, I'm going to be breaking it down in a way that's super simple and easy for you to understand. I'm going to throw in a lot of visuals and break it down in a way you probably have not been introduced to before. So go ahead and stay tuned to the very end as we get right into it. Now, before we go into it, I'm going to share with you guys. I do have a free resource, which is How to Master Pharmacology, and you're going to find it very helpful. It does have conversion values, and it goes over different terms that you absolutely need to know. So make sure you check it out in the description. Okay, so let's get into it, and we're talking about pharmacokinetics. Now, what is the root meaning of pharmacokinetics? If you look at pharma is drug, right? And kinetics, that word kinetics is movement. So this is all about the movement of a drug throughout the body. That's essentially what it is. And the movement of that drug is broken down into four phases or four steps: absorption, distribution, metabolism, and excretion. Right? Those are the four steps that a drug has essentially moved through the body in order for it to work. And throughout this video, I'm going to be providing with you some visuals along with also different analogies in the hopes to make this a lot easier and more simplified for you to understand. All right. So one way to look at this is think of it when, let's say you're on a road trip, right? You are driving to your location, wherever it is that you're trying to go to, and you have a goal in mind, right, to eventually hit your destination. Let's say you're going from California to New York, which is a very long road trip, but just for the sake of this example. So imagine now that the drug represents the car and the road is the body. All right. The drug is the car, the road is the body. So the drug is moving throughout the body, which is the road, in order for it to finally hit its destination. Right. Where now it hits, and the destination is when the road trip ends. Right. So think of it like that. Now, when you swallow a pill, or when a patient swallows a pill, what's going to happen is that once that pill enters into the body, there's a process it has to go through, right? It has to essentially go through the digestive system process, right? And so that's why it typically takes, maybe like 30 minutes to an hour before, usually 30 minutes when the patient begins to feel the effect of the medication. And this is what we call bioavailability. Bioavailability determines how much of that medication actually is absorbed, right? And so when a patient takes a pill and swallows a pill, usually only about 50% of the drug is actually absorbed into the patient's body, right? Versus if you give a patient a medication, let's say through intravenously, then 100% of it is absorbed, right? So bioavailability is pretty much dealing with the amount of absorption, right? Because of the format or the way that it's being um, consumed, the way that the medication is being consumed. All right. So now going back to the example of the road trip. So if you are, for example, if you're driving from California to New York, it's going to take a lot longer for you to get to your destination. But if you take a plane, right? If you take a plane from California to New York, you're going to get there way faster. And if you take a jet, you're going to get there even faster, right? And so think of it like this. That's essentially what intravenous is. As far as when you give a medication through an intravenous route, the patient is going to receive the drug so much more faster than the way that they would through a pill. And because of bioavailability, they're going to receive or absorb 100% of that medication because all of it is going to the circulation immediately. As opposed through a pill, it has to pass through the digestive system, and it may not, the full drug may not completely be absorbed into the patient's body. So once it passes through, that's absorption, and now it's going to be distributed. Distributed is where now that medication now is distributed across the entire cell membranes within all of the organs, the heart, the lungs, the liver, the kidney, everything, right? So now distribution is just dealing with the spread of the drug throughout the entire human body ecosystem. Think of it that way. It's being distributed throughout the human body ecosystem. That's what it's referring to when we look at distribution. And then this is also very relevant as far as when we talk about throughout the patient's cell membranes, which is what these pictures are illustrating, because now what's happening is that that drug is also crossing through the cell membranes and being, like I said, distributed all throughout the organs in the body. Now that it's done that step, now the third step is where we talk about metabolism. All right. So metabolism is where now the drug essentially actually becomes activated to achieve whatever the therapeutic effect is of that medication. So most drugs will usually go to the liver where they get changed into new forms, and the liver will break down the drug so that way it can be flushed out. And other times, the liver will activate the drug, kind of like maybe if you think of like a car turning on the engine, so to speak. So, for example, a codeine by itself, codeine doesn't do anything or doesn't do much. But the liver, though, is what activates it into morphine, which actually relieves a patient's pain. So just to make it very simple, the liver activates the medication, it metabolizes the medication so that way it can achieve whatever the therapeutic outcome is for that medication. This is one of the reasons why um, some patients may react differently to drugs than others because of their genetics, just because of how their body is programmed or how their body functions. But the main thing for you to understand is that the purpose of the liver is for it to actually activate the drug so that way the drug does whatever the reason why we give the drug for, which is the therapeutic effect. All right. Then finally, now the last step, now that the drug has now we mentioned, like we said, the drug got absorbed, right? Depending on what route. So if we talk about PO, and it goes through the mouth, right? Then it's going to take longer for it to pass through the digestive system, and not all the drug is going to be absorbed, but it takes more time. As opposed to if we give it through intravenously, then 100% of the drug is going immediately into the circulation, and then the drug is going to work way more effective and way a lot more faster, which is why you have to be more careful when giving medications intravenously than the way that we give it through by mouth. So now the last step is going to be excretion, right? So excretion is where the drugs actually leaves the body. So now you have hit your final destination, right? So the drugs now will leave the body to the kidneys. That's the purpose, where the kidneys filter the blood and send the drugs out throughout the urine. So that's why when we do like a urine drug screen test, we can see, depending on what type of drug it is, we can see what they consume because it will show in their urine. So the purpose of the kidneys is to make sure that it's to pretty much filter the drugs out throughout the blood and now send it through the urine. So it's very important patients that have good kidney function so that way they can properly excrete the drug. If you found this helpful, make sure that you go ahead and visit the resources below in the description. We have additional books along with also courses that will help you to better understand some of these topics that can be more challenging. Comment below, let me know what you took away from this and you found it helpful, and we'll definitely check out our other videos.